minute. So we'll be starting in just a minute, everybody. Good morning. Just checking to make sure that everybody can hear us on audio, and hopefully people are able to hear us, and we'll confirm that before we get started.
Hi, Megan.
Good morning, everybody. It's our weekly Care Manager informational webinar, and we're going to get started. Before we start, if people that are on the phone line, I'm not sure why, but we are getting some feedback. If you could make sure you're on mute, please. Okay, so we are going to get started. So hard to believe, everybody, that this is the last month of the first quarter. And I don't know about all of you, but it feels like in many ways that, July 1st was just, last week. And at the same time, it also feels like so much has been done and so much has been accomplished. So we're going to go through our regular weekly agenda and have a number of updates for everybody, a lot going on. First, I have to say that Jim and Ann send their regards. They actually are traveling and not able to be on the webinar today. I believe they will be joining next week. So today, again, will be myself and others will be doing the weekly update. We're going to start with human resource updates. Then we'll go through, there's a number of care management updates and new things that we want to make people aware of with some of our work with OPWDD. We also have our regular Metascad and IAM assessment updates with Lori. Lori's going to also provide an update on training records. We have Devin Kerr, who's going to be joining us to provide a quick update on IT and some of the work that they're doing to address some of the challenges and concerns that we're having across the field. We also have Danielle Wiltsey here, and she's going to be providing an update on her role and also on work that she's doing on individual and family advisory groups. Then we're going to have a quick update on our website and the ability to access translation services. So we'll go through that quickly. We'll also have an update on the ongoing saga with the Maximus and Cass assessor request and how we're approaching that. And lastly, we'll have shout outs. We have our new scaled down version of shout outs because we will be issuing a Care Design New York newsletter that will be starting either tomorrow or next week. So more to follow on that. And we're going to get started. Again, if everybody on the phone line could just mute, because again, we're hearing some feedback and I'm not exactly sure why. So if people could just make sure they're muted. And I'm going to just do one other confirmation to make sure that folks are all hearing us, because I know last week we had an issue. So I believe that, I think we're good. And if everybody's muted on the line, we will get started. Okay, so I'm going to turn it over to Suzanne Brown, who hopefully is on the line and is going to give us and walk us through our human resource updates. Suzanne?
Yes, can you hear me?
Yes, we can.
Hello? Okay, great. Hi, everyone. How are you? So I'm just going to go through an update today. I wanted to give everyone an update on recruiting and what we've been doing. Just an update on the refer a friend. We also got some information for updated qualifications for our care manager positions, and also an update on the ID badge project, which I know many have questions and wondering if they are going to be getting an ID badge soon. So just to start, so Care Design New York, we are continuing to recruit in full force. We've conducted some job fairs. I'm consistently doing phone screenings. And we are currently this month going to be hiring 26 new employees. 22 of those 26 are care managers. And we are likely going to be hiring even more this month. I've been getting a lot of interviews that are being conducted out in the field, and applicants that they are looking to hire. The Capital District, I know they have many openings at this point in time, so we are going to be conducting an open house. So we're going to be doing a job fair. We do have a tentative date for it, so sometime early next week, we should be putting that date out there to everyone. This way, also, you have an opportunity to use the Refer a Friend bonus, which is still going on. So if you do know anyone, even up in that area or even down here, you might know somebody that lives up there who, would be qualified for the position. You can definitely go ahead and refer them. They can either apply on their website, or you can have them directly send their resume to myself as well. With the Refer a Friend bonus, we have had over 30 applicants that have come to us through the Refer a Friend bonus, and that will be hired, and either in the process of being hired or have been hired already. So that's great. So we thank you for referring your friends, and please continue if you know anybody out there that is looking for a position, maybe a change in the field, as long as they meet the qualifications of those 2 years experience and the bachelor's degree. And if you're not sure about the experience, if you're not sure that they meet the qualifications, or you're unsure about the position they're currently in, please feel free to send it over to myself or anyone in HR, Steve or Lisa, and we can definitely review the resume, and we'll contact them and go over their resume with them. What else? Let's see. We are going to be updating our careers page. So we are currently working with web developers to put more information on our web page and also link it onto our Indeed web page. We have many, many positions on Indeed. That's where the bulk of our positions are posted. It gets a lot of traffic. Many people tend to go to Indeed before they'll go to a Career Builder or to Monster or any of those types of sites. So we're working on connecting the Care Design Network webpage, when you go to the career section, to the Indeed webpage, so that once they click on the position, it opens up and they can see all the positions available within the organization. I had mentioned that there was an update with qualifications. So OPWDD has broadened the qualifications. It was, experience working with people in the field of IDD or case management. So now we can look at other experience that qualifies people to work as a care manager. So now we can look at other social services fields. We can also include now internships, volunteer work, personal experience. Those are things that we weren't able to look at or be considered for prior. So now we can look at that, which is great. That helps open things up better for all of our applicants. And I think that's it for recruiting. With the ID badges, we are doing a pilot for the Bronx at one of the AHRC sites. I did just do the first order, so they should be receiving their badges hopefully early next week. So once they get them, and they look great, and I get feedback that all is good to go, we will move forward with getting everyone in the agency their ID badges. So within the next couple of weeks, you'll probably be receiving an email from us to start taking a selfie and send it in to us. And I think that's it.
Okay, thank you, Suzanne.
Thank you.
Okay, we're going to continue on and have some care management updates. First of all, this is really a reminder for everybody that as we're in the month of September, reminder that face-to-face visits must be completed this month, by the end of the month, for any individuals that are in tiers 1 to 3 who have not had a face-to-face contact in July or August. And, it's really critical that we make sure that those face-to-face visits happen for this first quarter. I know the quarter, the time goes quickly, so if August visits are needed, they should be arranged and conducted as soon as possible, or if September visits are needed, they should be arranged and conducted as soon as possible. And then, of course, the ongoing Tier 4 face-to-face visits, which I know people are aware of. So the other reminder is that I know that we've had a number of people covering and some transitions with caseloads. And if you have a Tier 4 individual that you recently, that recently became on your caseload, just to make sure that a face-to-face visit was completed by a care manager from Care Design New York in July or August. If not, then the responsibility really is yours to make sure that by the end of September, a face-to-face visit happens. And if you have any questions, definitely, work with your supervisors on that. Our next update is on Tier 4s. And we have been, Jim has been really leading an effort with OPWDD and the other CCOs on the Tier 4 requirements, and certainly the challenges that we're all under with the timeframes that are part of Tier 4. So the good news is that we are expecting to get an extension of time on complying with the 1-to-20 ratio, and we're expecting to hear by week's end. So that's really fabulous news, and our fingers are crossed on that, but it seems extremely likely that that will happen. So that really is great news for all of us. And we will certainly update people with more information as we hear. Obviously, for individuals who are Willowbrook class, we still absolutely, because of the permanent injunction, need to comply with the 1-to-20 caseload requirement. And, Jim really continues to advocate with OPWDD very regularly, and he does have another meeting with them to continue discussion about Tier 4 next Thursday. Okay, some other updates. We wanted to address the challenge that we've had with really, ensuring continuity of care for individuals that we support and trying to minimize caseload transitions while we're in a time where really, in order to, best meet people's needs, we have had to do some transitioning. So this is really a reminder and maybe some talking points that you could use as you are having conversations with individuals, families, or, even other providers as well. So Care Design New York is absolutely committed to ensuring continuity of care to the greatest extent that we can. We are certainly, living a situation now where we are not always able to keep an individual on a particular care manager's caseload. There's many factors that impact us. One is the Tier 4 caseload requirements and our move to try to work towards complying with that. So again, if we do get the final news on having an extension, that will be a great thing for us. Also, just the day-to-day changes that we have in the workforce where, on the positive side, we've had care manager promotions, which has been great, but of course that also impacts our future ability of caseload management as we need to kind of free up some of the supervisors' caseloads for the individuals that they may have taken on while we've been trying to provide coverage, across all the individuals we support. of course, people take leave, some people leave the agency in general. So all of that obviously impacts our ability to meet the caseload, to meet caseload coverage. And our efforts overall, too, where we've had significant caseloads that we're trying to reduce them. So that certainly adds to the challenge. So we realize many care managers have developed strong relationships with the individuals that you supported, possibly in MSC world in the past. And we really want to be able to, respect and minimize changes to the extent we can. And where we do need to have a change, we want to be able to ease the transition to the greatest extent possible. So the existing care manager in situations where we do have to make a transition should work closely with the new care manager in order to really best approach, involving someone new from care design as the care manager with the individual and family. We really are looking to a formal introduction, preferably a face-to-face meeting with the individual and family, an exchange of information. And also we really look to have the care manager who knows the family the best involved and available to be able to answer questions if the new care manager has any along the way in order to best ensure continuity of care. And also where possible, we are trying to have the same supervisor involved for continuity, because certainly supervisors really do get to know, it might be secondhand, sometimes it's firsthand, the individuals and families as well that are on the caseloads of the individuals that they supervise. So continuing on, the issue of caseload transitions is impacting not just Care Design New York, but certainly all the CCOs. We're collectively working with OPWDD on the Tier 4 changes, and as I mentioned earlier, we do believe we are going to get an extension. However, we are in a situation where we do need to make adjustments to some caseloads. We are going to try to minimize this and really be as sensitive as we can in general as we approach this. And we recognize definitely that in certain situations, some people should not be transitioned to another care manager. And if you do have someone on your caseload that, potentially, we may be looking, a supervisor or manager may be looking at trying to make some type of adjustment to your caseload, please make sure that they know that, because of X, Y, and Z, this individual really needs to remain with me and, provide that feedback so we can really look at trying to plan around that to the extent we can. And, bottom line, obviously, we recognize that, we'd love it if we could just have the full continuity and not be able to not be in a situation where we have to make changes. But we all need to work together to implement them, in the most sensitive way for the individuals and families. Okay, so switching gears, I'm going to turn it over to Lori now. We're on our IM assessment and Medi-Sched updates. So Lori will provide us with some updates.
Well, I don't know if they're updates. It feels more like an ongoing issue. So we're going to start with the IM assessment. Okay, so it's been a very interesting week, and the lead engineer and I are becoming best friends on the IM assessment. We are experiencing an increased frequency of IM assessments being locked. I have reached out to the other CCOs to see if that's occurring with them. I have been on the phone with Medi-Sched and the company that's built the IM. They are looking at it and doing what they can as soon as they can identify what it is. They believe it's the frequency of saving in relationship to the stability of the internet, but they're still trying to troubleshoot through that. In the meantime, they did share a little tidbit that was very important for all of us to know yesterday, is that you should not be checking out more than 2 IM assessments at a time. So leave them checked in. Unless you're working on them, then check them out, okay? My other piece of advice for you is, don't try to work on an IM assessment if you're not going to be conducting the IM assessment for months. Let's just do what we need to do right now and work through one layer at a time. There's plenty of time to get to everybody on your caseload, but we're trying to really minimize the number of issues. But in the meantime, we love pictures and we love videos. So if you have some anomaly happening, like the blue screen of doom we experienced this week, a video really goes a long way with showing the engineers exactly what's happening on with the system that you're trying to use. As well, we're talking about IM assessments, let's talk about Metascale a little bit. So Metascale updated the sandbox this week and over the weekend, but what they did, and we found out again the hard way, was they wiped everybody's passwords off, including mine. All gone, no passwords working, complete reset. You should see the facial expressions in the room with me. So you guys are probably thinking the same thing. Well, I don't know how you got on it, but they wiped everybody's passwords out of the sandbox. So I know some of you guys are trying to go in there and trigger assessments and practice, and some of you have group training that you're trying to do. Well, there's 850 of you. One of me and Everett was out had the day off yesterday. So as you can imagine, we are limiting the passwords resetting to the absolute necessary. We have put in a very high priority request to the Metascale engineers that they reset all the passwords to a generic password for us. Otherwise, it is going to take a tremendous amount of time for us to get all your passwords reset. But I just wanted you guys to know that so that to get in, please don't send us emails asking to reset your password unless you have a training or a life plan or an IAM or something coming up now. New hire, you might even have to wait just a little bit because, like I said, there's only like all told one of us who are working through this right now, and it's going to take some time to get to everybody. Bulk reset is the way to go, and I'll email you the bulk reset password as soon as I have it. Speaking of bulks, that bulk reassign feature out there for the supervisors where you can now move all of the one whole caseload to another care manager, they say it's working. Let me know if it is. I'm hoping and crossing my fingers for very huge success. Children's life plan. Remember there was a time when the life plans, you were doing children's and you were getting an error message from Metascale saying something about regulation and you couldn't do it yet, it hadn't been approved. I just wanted to let everybody know that that should be fixed. So if you have a children's life plan in progress or process and you've done your IM assessment already, you should now be seeing it in the IM life plan. So cross our fingers that you can see that there now. I'm going through my list real quick. Hold on one second. Okay, two other things on this particular one. Actually, is training next? Can I keep going?
Yeah.
All right, we're just going to keep going with training now. So I'm getting a lot of questions about OPWDD webinars and the ones as they're advertised, and should you guys be participating? We here at Care Design and the other CCOs meet with OPWDD every week on training needs, and we are actually driving what they're presenting as training, to be honest with you. So generally, anything that they present it as from a statewide system perspective, and they are doing the piece that talks about how it integrates with the DD service providers. So the webinars are generally something that we have asked, and they are different and more global and from a statewide perspective than what we're providing. So the short answer is yes. If they're relative to your caseload and your position here at Care Design, you should be participating in the OPWDD webinars. We push as much as we can to make sure that they're recorded and they're on there. I know there's one coming up, I think it's the 17th, that is going to talk about staff action plans, which is going to be critical because that concept of DAHAB, ComHab plans are kind of changing and morphing into more of a staff action plan, and that information is going to come to us differently in the future. So they are going to start talking about how they're changing the requirements of service providers and how that's going to interface with the CCO organization. So we'll try to do better at getting you guys more advance notice, but generally we get notice that's days in advance, and that's the best we can get. for right now. If we think it's really critical, we'll definitely let you know, and we'll put it the recording on Litmus for you. So speaking of our favorite topic, Litmus, I know that you guys are really stuck on courses, and I feel your pain because I can't tell you how many hours I spent testing these courses. The struggle is real, and I just want you to know that our entire team is acknowledging that. There are multiple facets that are playing into the issues, and we are fixing them, and I try and identify them as best we can. But right now, it's kind of like finding a needle in a haystack. So for the OPWDD Foundations course, thank you to, I think it was one of our Danielles here in our office that figured it out. And if I got her name wrong, I apologize. For figuring out how to get past the OPWDD course. I sent those instructions out to you on Monday with an email attached with the information for registering for training for this week. Or Tuesday, whatever day it went out. If you don't click the right X at the end of the course, you're not going to get credit for completing it. It's as simple as an X at the end of the course. So look at that. There are pictures in there. Fire safety, have no earthly idea why it's sticking on the same slide. There's no interaction there that should be causing that. I think we've narrowed it down to it may be a Flash player and a Flash player version on the Chromebooks. I've been in touch with other CCOs yesterday and this morning trying to figure out what they figured out, and we've all kind of collectively put our heads together. We think it's a Flash player. We are going to slow down a little bit on the push and kind of hesitate a little bit for this month so that we can let you guys get caught up and get through all of that kind of stuff and see if we can work through whatever the IT issues are. Yes, Danielle?
Lori, so if somebody thinks that they completed the Foundations of OPWDD for Care Managers, but maybe they didn't check that box, you were saying, or check something, can they go back and check that box? Does it show, or do they have to do the whole thing over?
You should be prompted to answer, when you log back into that course, you should be prompted to choose start again or resume where you left off. Hopefully you can resume where you left off, and it should take you right to that slide, and you can check the correct box. Okay, training records. As you know, Litmus does a fantastic job at keeping track of what you've completed at self-paced learning, but we're not able, it doesn't help us track when you guys do group learnings at your sites or with your regional directors, or when you go off-site to take additional training, and we really want to track that and give you guys credit for what you're doing. So we're kind of going to go back to old school like you guys do with MSCs, and you had an attestation form where you kept track of your training information. Those have been delivered to you. There should be blank copies in Litmus, and we'll if you email training, they'll send you more blank copies if you need. If you guys could track that and sign have your supervisor attest that you did complete or attend that training, including these type of webinars, that would be really awesome. We want to know what you guys are doing, and we want to give you credit for it. And we also want to know what training you're seeking out, so that maybe that's something that we should be bringing to the agency as a whole. So if you guys could do that and then submit them to training at caredesignny.org, that would be fantastic. And I believe I'm at the end of my list. Oh, wait, one more. Got to say hello to Scott at Hopewell Junction and Natasha in Long Island. They started this week. They're our new training specialists, and we tossed them right in the middle of the whole moving Amtrak train and said, here, paint the sides. So they are off and running, and give them a big warm welcome and help them learn our Care Design way, and welcome to the family. Now it's back to you.
Thank you, Lori. So I understand I got some comments that the slides weren't advancing, so I'm not sure what was going on, but we hopefully have taken care of that, seem to be paused. And what we'll do is we'll email everybody the PowerPoint after we're done today, so you have the slide deck. Okay, our next topic is IT. And Devin Kerr should be on the line to provide us with some updates. Devin?
Hi.
Hello.
Good morning. Hi, Megan. Thanks. Good morning, everyone. Just want to say, first of all, thank you, guys, for working with me over the last couple of weeks to understand your issues and taking the time out to work with me to resolve them also. So I appreciate that. I know I work with Patty and a couple other guys from different locations, so thank you. Just want to cover a few things with you guys. The Mimecast encryption issues, the MAS 360 on personal devices, and other issues like internet issues and Chromebooks. So first of all, with the Mimecast encryption, we did work with OPWDD to resolve the issue on their side, and they will be having a meeting internally to discuss the process of what they need to do so that when everyone sends email from CDNY to them that's encrypted emails, that they're able to open it and do what they need to do. So that's promising. We do have documentation on how to open the encryption email that we can send to everyone and for families to be able to open the emails. And if there's any issue that anyone has, they could always email helpme@caredesignNewYork.org, and one of the team members will be able to help. With MAS 360 on personal devices, you guys sent me your comments a couple of days ago on the email I sent out with the policy. And I want to apologize if I caused any confusion with the email. That we do have documentation for you to use the MAS 360 on your personal device so that you can be on the approved list to use the emails with MAS 360. So we'll get that out to you guys as soon as possible, that whoever would like to do it on their device. And the other issues that we are aware of, like the internet issues that most of you are having, and we think it's mostly pertaining to using the agency network with that the issues are happening. So we're right now working with some of the agencies to see if we can, one, increase the bandwidth that they're offering, or if they cannot do that, then we are installing our own circuit inside their location, and so that you guys can have a higher speed internet access to help you guys do your work more efficiently. We also are looking at installing immediately with sites who need better internet access right away is a quicker solution, Cradlepoint solution, that it's all-in-one network, will give you Wi-Fi service immediately. It's like your iPhone 10 times greater signal. So we have implemented that in 5 locations right now, which is working well for everyone. And on top of that, we also install circuits. So also with the open issues with the Chromebooks, that I worked with a team yesterday. I'm sorry, I don't remember their names, with downloading documents from Metasced into OneDrive. So we are regrouping today to come up with a solution, to see how best we can download the documents directly into OneDrive instead of from Metasced to My Drive and then to OneDrive. So we'll update everyone as soon as we get an answer on that. And working with you guys, I find that some of the Care Managers Chromebooks are not registered properly. So I just want to let everyone know that one of the things to identify with your Chromebooks immediately is, once you log in, and if you do not have the tabs open up open up automatically on your screen, and first tab should be Paycom tab, and you should have the IM app on your taskbar. That's a good indication to know that your Chromebook is registered correctly. I find that yesterday and last week, working with a couple of care managers, that they were having issues, and speaking with them, they did not have that. And once their Chromebook was registered properly, their services work properly on their Chromebook. That's it. And once again, thank you guys, and definitely let us know the issues that you're having, and we'll try our best to resolve them as quickly as possible. That's it on the IT side, Megan.
Thanks, Devin. I'm sure we'll have questions at the end for you, so hang tight here. Thank you. And I'd like to really thank Devin and Jim Brown and the other IT folks that really have been working very hard on all the different issues that, we're facing on the, care management side. So it's definitely a team effort. We really appreciate it. Obviously, it's a work in progress, but I think you guys have been working extremely hard. So thank you, Devin. Okay, I'm going to turn it over now and welcome Danielle Wiltsey. I believe this is your first Care Manager webinar that you're joining us with. And Danielle's going to just do a quick introduction of herself and her role, and then she's going to talk about individual and family advisory boards that we're going to be forming in short order. So thanks, Danielle.
Thank you. Good morning, everybody. I began working with Care Design a few weeks ago, and I'm going to discuss with you this morning information regarding the individual and family advisory boards. I'm excited to get this information out today. It is in the beginning stages. What I'm going to be doing is working on the advisory boards, which will be essential to the operation and evaluation of Care Design services. The family advisory boards will be forming in all the regions. We are looking at 7 regional boards through Long Island, New York City, Hudson Valley, Capital, and the North Country. For these meetings, this will give the individuals and the families time to engage, and also for us to get feedback regarding services through Care Design. The advisory boards will focus on many key areas. These areas could change as the boards are being developed. We are going to be looking at having individuals and families be actual board members and looking at how we're going to recruit for this board. Some of the other areas that will include is the hiring, training, and evaluating of the workforce of Care Design, quality and metric development, communication, outreach to any schools or programs in the communities that families are looking at, and also assisting Care Design in resolving any issues that may come up with any of the services that they're receiving. We are looking at individuals and family members to volunteer on these boards. The location of these meetings will be based on who is interested in participating in this family advisory board. We will ensure that we make reasonable accommodations for any of the individuals and families that would like to participate so that we can increase participation and attendance for these meetings. We are looking at the regional boards to occur regularly. I definitely will participate in these meetings face-to-face and ensuring that each board has 15 members and that the individuals and families can commit to attending these meetings. What we're looking at for getting this information out, there are materials that I've been working on. There is a letter that will explain the family and individual advisory board and how it will be utilized. What we're looking at is for care managers to communicate this information to the individuals and family, either through email, phone, or visits that may be occurring. We are looking at getting this information out by the beginning of next week. You will see an email come through, and if you have any specific questions regarding the information that's going to be distributed, to please reach out to me. My email and phone are listed on the slides. And if you have anybody that you know off the top of your head that may be interested, definitely reach out to me as well, and you can give me the contact information. We're very excited to get this program up and running, and any feedback that the care managers have, I would definitely appreciate it.
Okay, thank you, Danielle.
Thank you.
Okay, the next quick update that we want to give to people, last week on our webinar, a question came up about getting the message that we had people sharing with individuals and families from Jim Moran translated into other languages. And I wanted to make sure that people knew that we actually have on our website the ability that information that's on the website can be translated very easily, you know, with a filter that is set up on our website. And there's options for numerous different languages. And the message that we had you share from Jim actually is on the website and can be translated. And then as we have new information and other messages, et cetera, on the website, they'll be able to be translated for the future. So you should definitely use this as a tool and a resource, and also make individuals and families aware that may need information in other languages. And certainly the information that Danielle Wiltsey just shared, we'll have that on the website, so that'll be able to be translated. And just real quickly, I wanted to try to show people how we do that. So Lori is going to assist me with the technology here to try to pull up our website and just show people what we're talking about.
It is loaded up here.
Yep.
Very good.
Okay. So how do I minimize this?
Orange, the orange thing, the orange arrow.
Okay, so on the front page of our website, if anybody just goes in themselves directly, on the front page in the right upper area, there's a drop down that actually says English, that if you click it, it allows you to pull up a whole list of other languages that the information on our website can be translated into. And as you can see, it's a very extensive list. So I'm going to just go to Japanese, and you click it, and then the content of the website automatically is translated. So it's a simple thing. I think it's really a great tool and resource. And certainly as we have other resources and information, we're going to want to look at being able to post that on our website so it's available for individuals and families in a you know, very friendly language setup so that they can access anything that anybody else can. So wanted to make you aware of that. The other thing I just wanted to show, I'm going to go back to English, is that we actually have the message, the Jim Moran welcome message. It's under news and events. So if you click that, you go to CEO message. And then again, you can just go right back up here and you can click on, you know, whatever language, let's just do Albanian, and it'll translate into the other language. So you could cut and paste from that to bring out to share with individual and family. You can refer them, give them the link to the website. We'll be posting more information in the future. You know, there's many ways that we can use that really in a way to be, you know, communicating much more effectively. So wanted to make sure everybody knew that. And again, we will share the PowerPoint later on today with everybody, because I know it seems that there's still some people that aren't seeing slides advancing, so I apologize for that. Okay, so Lori, we got to get back to our PowerPoint.
Click on PowerPoint on here. And then you don't have to see the rest of it for right now.
Is that it?
Oh, no, go to right here. There you go.
Okay, we're trying to get back to the PowerPoint here. Now I lost those other questions, but, okay. So continuing on, the other quick thing we wanted to provide an update on is ICD-10 code information. This has been the hot topic for us as we're going forward with our IM interviews, and we all know that that's part of the expectation as we are doing care management and IM assessments, and we are further along with accessing people's health and medical information and diagnoses, that we do have that as something that a care manager will need to be aware of. And of course, we need to really engage in much further training for all of you to really be able to do that effectively. I just wanted to really quickly say that these slides, I wanted to thank Tinia Wilcher, who actually helped to, who provided that to me to share with people. This is just really a basic ICD-10 list for intellectual and developmental disabilities. And I'm going to turn it over to the expert, Dr. Paul Byron, just to give you a few more comments on this. Go ahead, Paul.
Well, I'm glad I'm the in-house expert, but I'll share that questionable responsibility with the folks from training, with Lori and Nancy and what have you. And again, the message is that we're going to slowly give you information related to the general healthcare needs of the folks that we take care of. Give it to you piece by piece, because in those instances, we're in that very confusing world of medicine many times, because I have to do this stuff and it's confusing to me, that we're available with basic information that we give you. We're available to answer those questions if you get stuck. And these are the basics of things that you might need to know early on. And so the international 10th edition of diagnostic codes is about a 3 or 4 inch book at this point. And so luckily, we're not going to create ICD-10 codes in our organization. All of those codes are going to be available to us, sometimes painfully, to try to pull them out from places, but they're going to be available to us because they're already created by other people. In general, we're not going to create ICD-10 codes. So, for example, if you're looking for an ICD-10 code for a developmental disability diagnosis, these are very common ones that are on the slide here today. It's not all inclusive. There are other ones, but those might be found, say, in tabs, for example. Someone has already designated the official ICD-10 code for that person's developmental disability. When you get into doing ICD-10 codes for individual diseases, especially the chronic diseases, which we're going to focus on, you're going to find those kinds of things are already going to be created by someone in the healthcare, that person's healthcare system, many times their primary care doc, who's going to have a diagnosis and an associated ICD-10 code, and actually that's how they do billing. So it's also important that you remember that we don't want different codes created by different people. When the billing people see 3 different codes related to one diagnosis, there's going to be problems in identifying which billing, proper billing procedures we're going to use. So we're going to use other people's diagnostic codes, ICD-10 codes, and eventually we'll start to use those codes as we get more into identifying people's chronic diseases and talking about the kind of things that we have to include in our record keeping. And I want to tell you up front too, because we talk about this in training also, and amongst the training folks that are here, that when you start to add information to your IM assessment, to your life plans and what have you, that we're only going to slowly add some of this information, because you have to make sure you're accurate in putting in diagnostic codes. It's not so hard to put down hypertension as an element of an IM plan or as a piece of information in your medical record, but you have to be sure that you're using the proper ICD-10 code. And so we'll slowly come up with that kind of information for you and tell you how and where to find it, and then how to double check that to make sure that it's accurate information. And that's pretty much it. We just want to introduce the fact that we're going to be using the codes. They're sometimes difficult to find. We try to stay on the same page and have one code for one diagnosis be used by everybody. And if there's any problems or questions, you can come to me. You can talk to people in training about how to get those kinds of things.
Okay,
Thanks.
so everyone, more to follow on that, and we will be providing further training and guidance. Thank you, Paul. Okay, just a quick update on the hot topic of where are we with CAS assessor requests and being able to share information. And it's changing by the hour, but as of the end of the day yesterday, we are on hold. Ourselves and all the other CCOs, we do not have resolution yet. So therefore, we still cannot share information for the individuals on your caseload with Maximus or OPWDD CAS assessors. We will be, once we get the green light and some legal things worked out here, we will let you all know. But please, in the meantime, do not share information with CAS assessors till we, give you the direction to go ahead. And we are also working on compiling the names of the CAS assessors from Maximus and OPWDD, so that when we do have the green light to proceed ahead, you'll know specifically who is authorized or able to access the information for purposes of the CAS assessment. So more to follow on that. Okay, shout outs. So I'm going to start them. Danielle, Mazza, and I will rotate. We are only going to highlight 2 to 3 shout outs weekly going forward. And what we're going to do instead is come out with a newsletter that will really spotlight all the shout outs. But we're going to try to have more time devoted to the content of the webinars. So we'll be sharing them in every other week, Friday distribution to everybody. So please keep sending them in. Okay, go ahead, Danielle.
Okay. This is to Jean Risdall, Senior Care Manager Supervisor, Bethany Jacobs, Care Manager Supervisor, and Christina St. John, Care Manager of the Kingston office. They support a person who was arrested and charged with a serious and sensitive crime. It's a complex case that includes visits to the jail, discussions with the public defender, district attorney, mental hygiene legal services, and several courtroom meetings, which have sometimes become a little heated. They've advocated and ensured due process with the residential agency, works very closely with the DDRO, and continue to ensure that the person has appropriate legal representation. They advocate to ensure that appropriate, intensive, and deliverable level of supports are available when the person is released. They have done an outstanding job. And this is from Margaret Winkler-Hoffman.
Okay, the next shout out is to Cassena Long, Care Manager. She was able to secure not 1, but 2 individualized support service ISS apartments for people supported on her caseload. We all know how challenging and difficult that can be. She attended open houses and worked diligently to achieve their goal of living independently in the community. So that shout out is from Annabelle Batista, Care Manager Director. And we have our last shout out.
And our last shout out is to Danielle Trumbull, Karen Boulay, and Tricia Chapman. And I just want to mention that, I had some conversations with some of these folks too surrounding this particular situation, because this is somebody that I worked with some years back and didn't realize that she was actually being served by Care Design. So this shout out is for the amazing work they all did in a difficult circumstance this past week. This team worked together and showed exemplary communication and follow-up when a person we support had a medical crisis. This person's medical status is still very touch and go, and it is no doubt difficult on all care management staff involved. This team has gone the extra mile to reach out to family that has been disconnected over time. So they were really able to reconnect, her family with her father with her, and her brother. They did an amazing job locating the family. This shout out is sent with well wishes for the person being supported and to the team for all they have done, from Carrie Wood.
Okay. So that concludes our webinar, and we have a little bit of time for questions and answers. So we have many, and we see still comments about the slides being frozen or not changing, and I'm not sure what the issue was. So again, we'll send out the PowerPoint. We apologize for that glitch. I'm really not sure what happened with that. Okay, so we are going to go through the slides.
Oh, so somebody asked, first off, this is Lori. When we were talking earlier, I should have said thank you to everybody who's coming up with creative ways to send me information to get to Metasched, IAM, the IT department, and occasionally even the care management team. What they like the most is videos, and I neglected to tell you guys how to do that. Well, your iPhones have the capability of taking videos. And it's super easy. It's so easy that that's probably how much of your best YouTube videos are out there, are made or on the iPhone. So just take your iPhone, make the video off the iPhone, and then email it to me. If you need somebody else to hold the phone and help you while you're driving what you're doing on the computer, that's fine. And if you want to talk through the steps you're taking, that's fine too. And it has to be 30 seconds is generally all it takes is to show us what you're doing. And I can't teach you how to use videos on the iPhone because I would actually have to ask my kid. So I would ask somebody younger than you sitting next to you how to do it. There was a question, some questions have come up about the IAM training and the passwords. If you guys are doing group IAM training, the super users should still be able to reset those passwords in the sandbox. However, if the engineers go through and do a bulk reset across the board, you're going to lose those passwords, and we'll communicate with you guys with email when we do that. So yes, the super users should be able to reset the passwords in the sandbox unless they change the access levels to mirror production, and I have not tested that yet.
Okay. There's some Tier 4 questions. The first question is, what if you only have 5 Tier 4s? Must your caseload still be a maximum of 20? And yes, the maximum of 20 is still in place, for a reason, obviously, that the requirements are higher for people in Tier 4. They have the monthly face-to-face requirement. So even if you had 1 Tier 4 individual on your caseload, that really puts us in a situation of needing to comply with 20. There's a question that also asks about the update we provided earlier, that there's going to be a little bit more time, or so we believe. We're waiting to get this in writing from OPWDD to comply with the 20 caseload requirement. And that time, is not going to be a long period of time. We expect it'll only be a couple months, but that will certainly help us to be able to continue to meet the needs of everybody and work to, as much as we can, adjusting the caseloads down and coming up with a plan for the Tier 4 caseload coverage, while we obviously have to increase our workforce to be able to do that. So Suzanne reported earlier on the very active hiring and onboarding we're doing, which will make a significant impact in our ability to really get the caseloads down. And that absolutely is still our commitment. Okay. Let's see. There's so many comments about the slides not advancing. There's a question about some specifics about Tier 4 designations and caseload size and people on your caseload. Please bring that concern and challenge to your supervisor so that we can look at, our best way to work on the plan for the Tier 4 individuals. Certainly, we're not going to be able to sustain a model where we have 1 Tier 4 person or even a few Tier 4 persons on a caseload. We are going to have to move to having caseloads that are primarily Tier 4 for the Tier 4 individuals, and then other caseloads, obviously, which would be the most people would have, that would be the Tiers 1 to 3. it becomes really a management challenge, and a financial issue too. So we are going to have to, we're working with our management team really to implement that and try to work in that direction. Okay, let's see. We already answered that. All right, there's a question on, is there anything different we should be doing with the IM assessment life plan for people enrolled in basic? So I don't know, Danielle, do you want to do a quick basic update or?
Yeah, so what we had realized was that the platform Metasced had developed for documentation of services was really built on the health home care management model. The requirements for basic plan of support are a little bit different, are a little bit more like MSC documentation because there's a monthly summary required. So we had some meetings with Metasced, and we actually convened a subcommittee of people from the various CCOs, and we've had 2 conference calls. We've reviewed the proposal that Metasced put forward and made some suggested revisions on 2 different occasions. So the ball is back in their court. So we're waiting to see what their final revision is. And we are hoping that when they provide that to us, that we can test that in the sandbox first. They mentioned doing a live demo for some of the CCOs, to kind of walk us through how that's going to look. And then we want to be able to get training, of course, out to all of you guys on how that documentation needs to be done and what it looks like, and all of that. So we're hoping, I think Metasced really wanted to sort of rush the release of that, and we want to, it's been this long that we haven't had a good platform. We want to make sure we get it right. So we were advocating for a release date from Metasced of the 18th of September. So that's where we're at with that. But that would definitely look different than the tasks that the way that you're doing the documentation for health home care management. So we hope that will be available for us to start testing soon, and then to be able to train you guys on that.
All right, there are some questions, several questions along the line of the IAM assessment. And I'm hoping I didn't confuse people with my update earlier. If you need to practice an IAM assessment, you should be able to log into the IAM app. And then there's a line that says choose CCO or change CCO, and then you should be able to pick the IAM or the Care Design sandbox. That sandbox is the sandbox for the IAM assessment, not the sandbox for coordinate, and that should allow you then to practice the IAM assessment and the questions through there. There was a question about, and if I'm interpreting this, about supervisors being able to make changes to correct clerical errors in the activity notes when they're reviewing them. The only way I would know how to do that is if you actually were to go into the note itself and then mark it incomplete and then make the change itself. I know it's a little bit of a challenge that you guys can't do that, but I think that's just kind of how the system is locked right now. There was a question about how to know how long training should occur. The training, every Tuesday, Thursday training is always blocked out for an hour and a half. We try to be respectful of your time and get the bulk of the content within the first hour and then follow up with the remaining on the questions. Sometimes it's shorter. This week, Danielle's doing a nice job of keeping things moving right along, and your questions are short. So today will probably be less than an hour because we just went to an hour earlier this week. So I'm going to be candid. We generally don't know week from week how long our information is going to take because we're still in a very reactive mode to developing and understanding what your needs are and then what our needs as an organization are to make sure that Metasced and care management is working as planned.
Okay, Devin, if you're on the line, there's a question about the MAA F360 is not on my CDMY iPhone. What should I do?
Oh, okay. With the Mass 360 on your personal device?
No, on the
Is that the
CDMY
question?
iPhone.
Well,
No, the question, go ahead.
Sorry, go ahead.
The question is, it's not on my CDMY iPhone, what should I do?
So the Mass 360 is not on the person's iPhone. They please please email us your information, your phone number, and contact information so we could check it out and take care of it immediately.
Okay, Devin, who do you want the email to go to?
If
Help
you
me?
could send it, yeah, please.
Okay. Okay.
Oh, no, the August 30th trainings for last week were put up in a litmus at 11 o'clock last night. I was up late getting caught up.
Well, wait, supervisors too?
The supervisors, too.
Okay, great.
I'm only one behind on Christina's,
Yeah.
and that's because at 11 o'clock last night, I couldn't remember what it was.
I think we have to come up with a plan to support Lori and have some other ways to get things posted, so.
We do have a
We're
plan.
working on
We
it.
worked on that plan yesterday.
Okay,
We
good.
think we have it.
Oh, good, I can't wait to hear the plan. All right, so, let's see. All right, so here's a question for you, Devin. OPWDD staff are refusing to open encrypted emails. Some simply say they cannot access it, and others have admitted they are just not able to create account passwords for every agency's encrypted email system. So Devin, I know Jim had been in dialogue with OPWDD. I don't know if you have any update on that.
Yeah, we work with Karen Ambrose and local IT from OPWDD to go through the documentation of how to open an email, and they were successful doing this. And they are having an internal meeting to discuss with the IT, with their staff, on how to open the email. Because they have similar secure email feature too, that we do the same thing with them.
Okay, so Devin, here's another one for you. Any news on the documents that disappeared from all of our Google M Drive, hours of work lost?
Yeah, that's a tough one. Because speaking with a couple of the care managers on this, is we find that some care managers were saving the documents one is we did speak with Google about it, and it's very difficult for us to restore those documents. We talked to them to find out if there's any way possibly on their cloud that it was kept, and they said because of how the Chromebook is set up as a security, so that when you save documents to My Drive, it's a temporary space. So what happens when the Chromebook is updated, version update, which is automatically done by Google Chrome, nothing is supposed to be on the Chromebook. So what it does, it refreshes the Chromebook, so anything that's on it is removed from it. So I did speak with a couple of care managers about this, and they were unaware that it's a temporary space. So when you download a document there, you should then move it to your OneDrive. I think I did speak with Nancy about this to say maybe we should have some type of targeted training on this to assist the care managers.
Okay, so we'll work with you guys and with Nancy to try to get some more guidance out to folks and further address that. Okay, there's On to the next question. There's a question about whether Care Design can approve or fund a sign language interpreter for a meeting with an individual's deaf parents. And yes, we do have the ability to, we have some agreements with some different companies that do ASL interpretation. So if you do have a need, please bring the specific information forward to your supervisor, and they can then connect with myself or Danielle or Christina Cunningham, and we can get the information about the company and come up with the logistics to plan for that. We have been doing that and absolutely want to be able to make sure that individuals and families can understand our communications and are able to be active participants.
There was a question about when documenting the Thursday Care Manager webinars and the Supervisor webinars on your training form, who should you list as a presenter? And I think you should list the Care Design leadership team, because clearly it's a whole team of presenters and it's never just one person. So just put the leadership team.
Okay. All right. So somebody is asking about the OPWDD CAS assessors that are requesting information. And at this point, we're not sharing information with any CAS assessors, even if they're OPWDD, and they're aware of that. And we are, fingers crossed, hoping that there'll be a quick agreement. And so for now, we are not information sharing with CAS assessors, and hopefully they're not still contacting us because they are aware of that, including the OPWDD CAS assessors.
Let's do this one for Dr. Byron.
Dr. Byron, regarding ICD-10 codes, what do we do if someone's diagnosis in tabs or choices is no longer accurate?
Well, first off, I think we would want to know. Paul's looking puzzled. I think the first question is, how would you know it's not accurate anymore?
I think we should look at the specific situation. If the person could email the specifics behind it to Dr. Byron, then we can take a look at it. And again, we are going to be giving more guidance on this in a future session.
And just to be clear, none of us are diagnosing.
Right.
Nobody in Care Design is diagnosing. Well, Paul.
Yeah, but I know just from, this is Danielle, from being out and about the IM assessment, asking for people to add things like history of, and making sure that the right, the full, again, people are not medical professionals. The IM assessment without incorrectly documenting information and symptoms was one. HIV was showing up as a symptom. So
I think we're early in the process of trying to add some of that information into either the IM assessment or into the medical record. Now, you'll read a physical that's done by the person's doctor, and you'll suspect that much of that information, especially if they give you codes, is going to be accurate. But I still hold off a little bit before you add all that information until we can get some formal training and get some advice, some uniform advice for everybody to follow, in terms of what stuff you're going to put in where and when you're going to put it in there.
And just so everybody knows, and we'll follow up hopefully soon next week or two on Lessons with Lori. In order to have waiver services, there's already a diagnosis code that's in Metasced. So don't panic if you don't have a code to put in there. It's okay to leave it blank right now.
Just a quick comment here. The CAS, someone had submitted, the CAS interviews continue without the care manager. Provider agencies are supplying documents needed to complete the interviews. and care managers are just being notified, which is fine. You know, provider agencies absolutely, you know, can do that, should do that. So thank you for that update. And we'll do one more question because I know we do have to wrap up. Let's see.
Yes, you can list the webinars today in your training records.
There's a question about whether there's any discussion about extending timeframes for life plans, the December requirement by December for Willowbrook class member tier 4s. And no, we are not aware of any discussion around that because of the permanent injunction and the Willowbrook parties, you know, really focusing on having a higher level requirement for the Willowbrook class individuals. So we're not aware of that. If we are to hear of anything, we'll certainly make people aware of that. And the other questions, you know, there's a number of tier 4 and other IM questions and training questions that we'll try to work on getting information out to people and or potentially addressing next week in our webinar presentation. So we're going to wrap up now. And again, we apologize for the slides not advancing or being frozen. We'll send the PowerPoint out to people. And thanks everybody for joining our weekly webinar. And we'll be connected with you on this again next week. Have a great week. Bye-bye.
Bye, guys.
Bye. Thank you.
Bye.